Thanks, Chair, and many thanks to the Concern for the invitation to attend today's event. Friends, I think we can all agree that good nutrition is the most significant maker and marker of human development. And as such, good nutrition therefore mutually reinforces the four policy priorities in Ireland's international development policy. And I suppose my remarks today, to put a caveat across, I'm not a nutrition specialist. I'm the Deputy Director of the Policy Unit in Irish Aid, so my remarks will be sort of from a policy perspective, an Irish Aid policy perspective. So within our international development policy, A Better World, we have four key policy areas: reducing humanitarian need, gender equality, strengthening governance, and climate action. And we believe nutrition and good nutrition is actually relevant to all of those. All of them, in fact, being framed by the overarching objective to reach those furthest behind first. This requires a consistent focus on those whose fundamental human rights, including the right to adequate food, are threatened or denied by intersecting forms of deprivation and marginalization. Be malnourished children, women unable to access health care, people living with disabilities, or smallholder farmers whose livelihoods are threatened by climate change. Vulnerable, marginalized, and poor populations are the most affected by undernutrition. In order to reach them, as with all the presentations made by my colleagues earlier, we know that interventions for the prevention, detection, and treatment of undernutrition are needed at scale, alongside a coordinated and expanded nutrition-sensitive approach, which is both multi-sectoral and multi-stakeholder. Ireland, for its part, has historically supported a wide range of nutrition interventions and programs, with a particular focus on preventing undernutrition in early childhood, especially by targeting the 1,000-day window of opportunity from pregnancy to the age of 2. Improving infant and young child feeding practices and promotion of exclusive breastfeeding for infants up to 6 months of age are a particular priority for us. In humanitarian and crisis situations, we support emergency responses to food crises, including programs that support the treatment of acute malnutrition in people's homes or in community clinics instead of crowded hospitals. Community management of acute malnutrition, or CMAM, and we heard a really interesting presentation on CMAN's surge from our Concern colleague earlier. But CMAN itself was first piloted and developed by Concern Worldwide with Irish Aid funding actually some 20 years ago before being rolled out worldwide. CMAN has indeed been a signature success story in both prevention and treatment of wasting, with evidence pointing to its capacity for significant scaling and further impact. Reducing humanitarian need means anticipating and, where possible, preventing as well as responding to crises, so as to protect the most vulnerable and those at risk. This focus on prevention as well as treatment of child undernutrition is important. Prevention is often overlooked in emergencies to the detriment of longer-term improvements in nutrition across generations. Ireland's commitment to reach those furthest behind first indeed provides an opportunity to focus on maternal nutrition, which is frequently under-resourced in humanitarian settings, but is integral to protecting infant and child nutrition, as well as that of the mother herself. Ireland's commitment to education, health, and social protection in emergency settings as basic elements of a functioning system also provide opportunities to advance nutrition outcomes. Nutrition gains can be maximized by ensuring that efforts towards each of these elements, as well as to the whole system, are adapted to be nutrition sensitive. We know that there are promising examples of nutrition sensitive multi-sector responses in protracted crises that are becoming more evident in practice and in the research literature. All 17 of the Sustainable Development Goals rely, at least to some degree, on healthier, more sustainable and equitable food systems, making them absolutely central to the achievement of the 2030 Agenda. In conjunction with food systems, global health and social protection systems are critical vehicles for combating malnutrition. However, these systems, generally operate in silos. and all have been weakened by the impact of COVID-19. So coordinated work across these systems is essential in order to prioritize and scale up high-impact nutrition interventions. Building on the recent UN Food Systems Summit, and now through the Nutrition for Growth Summit, Ireland will make two main policy commitments. First, we will support innovative programming approaches for the prevention and treatment of wasting, with a particular focus on tackling wasting in children under 6 months of age. Second, we want to share our own experience of developing our National Food Vision 2030 strategy as part of the Food Systems Transformation Pathways as a follow-up to the Food Systems Summit. Our emphasis will be to support partner countries as they develop their own strategies, emphasizing nutrition and context-specific approaches. Maybe Gillian can begin to put up the slide. At the Food Systems Summit, Ireland participated very actively in the wasting reset process with all our member states, NGOs, and various stakeholders. 6 key areas, as was mentioned earlier, were identified, and one of these was around the area of financing to address undernutrition. A subgroup worked up 4 key messages, and I'd like just to point to those very briefly. The first one is that we need to increase our political and financial commitments to achieve zero hunger. It is estimated that up to $12.6 billion per year is urgently needed in financial commitments to reach the Sustainable Development Goal 2 targets by 2030. For sure, therefore, political momentum is required to ensure these financial needs are met, from domestic resources in country, international donors, philanthropists, and private sector contributions. Ireland, for its part, will be making a substantial financial commitment at the Nutrition for Growth Summit. Ireland remains one of the highest donors as a percentage of ODA to nutrition, and we aim to and expect to continue to play that leadership role globally. Last year, Ireland committed nearly 19% of its ODA to nutrition. Secondly, more accurate and comprehensive financial estimates are required for wasting prevention. The number above I mentioned includes only the cost of severe wasting treatment. The costs of treating moderate wasting and preventing wasting have not been included. Yet we know that if we focus purely on severe wasting treatment, sustained reduction in the numbers of children becoming wasted each year will elude us. So for improved advocacy and programming, we need more comprehensive financial estimates on wasting prevention that also complement our stunting prevention work, which is part of the broader multi-sector approach to nutrition. For Ireland's part, we will continue to be committed to having better data, better information in which to inform our programming decisions. Thirdly, financing mechanisms and flows need to be more sustainable and effective. As mentioned by some others, alongside the humanitarian funding, longer term and more flexible funding is needed. And I think that has come out strongly in the presentations so far, both for sustainable wasting treatment and also for wasting prevention. This requires funding that builds resilience into health, food, and social protection systems. Funding should prioritize cost-effective, scalable, and proven measures. For bilateral and multilateral donors at the country level, including in some fragile contexts, this also means, after proper risk assessments, supporting and using government systems as much as possible. Funding should preferably be at least on plan, on budget, and on audit. And what we mean by that is that funding mechanisms and funding support should roll in behind the national development plans and national health plans, should be recognized within government budgets, and should indeed be audited through government systems, audit systems. For Ireland, pooled donor funding arrangements in support of government health and our systems are our preferred modality. Importantly, we believe this can improve the quality of sector dialogue with government in important areas, as we've been discussing today, with national nutrition policy, health system strengthening and transformation, and universal health coverage. In particular, donor dialogue on and donor support to public financial management is crucial to promote efficiencies, value for money, and risk management. For the health and nutrition sectors, I think was mentioned by our colleague from Niger, strong and efficient public procurement systems are particularly important. If a procurement system has systemic problems, increased funding in the end will not really matter. At APIC's donor government dialogue tables, as are present in most countries, engagement on medium-term expenditure frameworks, or where there is no empty medium-term expenditure framework, at least beginning a discussion to encourage the development of one, are in fact key to establishing multi-annual funding for health and nutrition and other services at the country level. Finally, we need to determine the means of measurement and accountability. Contributions towards the financial targets that we need to set need to be visible, including both domestic resource allocation and international contributions. The Global Nutrition Report can be leveraged to provide an annual update on this, with commitments and gaps tracked to keep stakeholders accountable. For Ireland, we're absolutely agree that targets need to be visible. Ireland is a strong supporter of the new nutrition policy marker, and we are committed to using the policy marker in all our reporting. I'd like to conclude just with two last slides, if I may, if we go on to the next slide, Gillian. I know there was a briefing around today's session around building resilient systems and resilient health systems in particular. So I thought I would just throw up, just to encourage discussion in the future perhaps, or to remind us of resilience framing and resilience frameworks. And I think this framework, most colleagues perhaps on the call are quite familiar with it. But I put it up really just to remind us about the complexity of building resilience at different levels, that at building capacities at absorptive level, at adaptive level, and at transformative capacity and transformative levels. And indeed, trying to build all of those capacities across a range of levels from household, community, institutional, and national. So in this discussion, I think, which is an important discussion about building resilient systems, and particularly building resilient health systems, it's important to interrogate this framework. It's not the only framework. To think through where we are working as an organization, where we're working as an international community across this system, like a particular lens. If you could just put up the last slide, please. And just as an example, from Ethiopia's Social Protection Programme, which Ireland has been a long-time supporter of, notwithstanding the current trials in Ethiopia, the Ethiopia Productive Safety Net Programme is ongoing, and the PSNP programme is internationally recognised as quite an exemplar of its type. But this is a mapping exercise which we carried out in the Addis Ababa Embassy while I was in the mission there, trying to actually map out how the PSNP programme, which contributes to nutritional outcomes at household level and community level, how it was mapped, how it was performing against the resilience framework. And we use this, if you like, as a tool for dialogue, both around the donor table and with government, to help us improve our dialogue and to talk about how we can improve the system going forward. So it's just an example. This could be done also easily for the health system as well, try to help interrogate where we are in building our resilient systems going forward. So I think with that, I'll pause and just end, happy to take any questions as they arise. Thank you very much.